So we had two budgets. Medicaid is only funded out of the general fund, not the education trust fund. And so what you do is you allocate funding to the general fund to fund the expansion. And the remaining amounts of money goes to the education trust fund.
And once that's done, you can depend on Governor
Then you have an opportunity to secure a bond. So you can't, the lottery still have to go to the people. We're looking at expanding before that piece happens. And so that'll guarantee the bonds. That money to the anticipated growth of a lottery. It'll take a couple years to happen, but you have to have a funding source or a projected funding source in order to secure, be able to get the bonds to have the initial upfront costs.
And Governor Ivey is on board with.
Oh yeah, she'll be on board with that.
To stay on Medicaid.
She's on board even if we don't do that, to be honest with you. We're just trying to figure out ways to fund it, the upfront funding, because the legislature still has to allocate the funding. It is the funding. Our job is to pass budgets, and we have to have the revenue to do it. And so she can say, I want to expand tomorrow, but if the legislature doesn't pass anything with a funding source, then you don't have the revenue the governor's budget has to come through us too. So there's nothing that could be funded without going through the legislature, government or outside.
Okay. I'm Laura McCauley with the National Coalition of 100 Black Women. And my sisters here, we were having a conversation about the food tax, removing tax off food. And was it stalled in the legislature, the bill to remove tax from food?
The bill that was stalled was the bill that allowed municipalities the opportunity to actually lower their or eliminate their food tax.
Mm-hmm. So is there a bill coming through from?
There are two bills.
Okay.
Representative Hall has a bill about eliminating from the state side, eliminating the sales tax off groceries.
Okay.
Representative Chris England has a bill that has local application, meaning that municipalities will be able to, it'll give municipalities the opportunity to remove the tax off groceries locally.
Okay.
But one of the things that we must think about is when you remove the tax off groceries, that's $470 million taken away from the Education Trust Fund. And so the advice, although the Education Trust Fund is growing, we have to keep in mind that we have to do it incrementally so that we can get to a certain point, but you have to have the funding sources to backfill the money that you're going to lose. Mm-hmm. But local municipalities, I think 4 cents, goes to, when you buy something out of Kroger's or wherever, 4 cents goes to the city. And so this one bill allows the cities to eliminate all of the entire 4 cents or parts of it. And the state portion is about 4 cents. And so there's a bill to eliminate the state portion incrementally. And so that's kind of how it's funded.
So you're going to send out a blast for us to get that bill number? Because I know
we'll give it to you today.
Okay, because from my consideration is if the children are not coming to school because they don't have healthy food and they're sick in class, that impacts academics. So it behooves us all to make sure that the low income have all the dollars that they can to buy healthy choices.
So here's where we are. Those individuals that, right now, individuals that are on public assistance, they don't pay taxes on the food right now, right? And so those individuals that I mentioned are on the Medicaid, food stamps, I'm sorry. Those individuals that I'm mentioning as it relates to Medicaid, those that are a little bit above the federal poverty level, they do have to pay it. And so there's not necessarily a way, unless you issue some type of card or something, for us to tell, to segment the population as to who should be able to pay, for the taxes on groceries and who should not. And so the best thing to do is to allow local municipalities, give them the ability to say, if the city council, mayor and city council, one particular bill wanted to eliminate the tax on groceries in Huntsville, they could if this bill passed.
And thank you, Representative Hall, for trying. Thank you. for trying to get the grocery tax removed.
Well, the thing about this session, we just completed our 11th day during the session, so we have about 19 more days. And what I've done, I've researched all of the bills that have been introduced over the last 20 years. The one that seems to have the most appeal seems to be the one that allows, when the increase in funding, if a percentage of more than 3%, if the budget's increased more than 3%, that each year that you would take off 8 cents for the next 4 years. So that has been presented to the chair of the Education Trust Fund. We're waiting for that to be brought up for discussion, hopefully within the next couple of weeks. Thank you.
Richard again. Two things. One, I've looked at several studies, and it appears somewhere in the range of about 3,000 people in Alabama have died prematurely, and somewhere in the range of around 70,000 nationwide from the states that either delayed or have continued to not expand Medicaid. And the other question is, with regards to the funding, will there be anything left for scholarships or pre-K?
Yes.
Okay.
The internet sales tax, we passed a bill probably a year or two ago that allowed Alabama to start taxing online sales. And so with that, we've experienced significant growth to the sum of $60 million or more in sales tax going into the Education Trust Fund. So we are experiencing the growth. Right now, we're fighting over the distribution of that money right now, because the state gets 4 cents of that, and we're fighting because right now in Madison County, if you buy something online, that money is distributed across the state based upon the population. It's not necessarily impacting Madison County. So that's something that we're looking at and we're fighting over right now in the legislature.
Earlier, you mentioned that the county could make their own decisions on certain things. Can we in Madison County decide to accept the expansion and make that happen on our own if the rest of the state doesn't want to do it?
I don't think that will happen.
I would like to ask the legislatures this question. I'm wondering, have we had any explanation on why the national audits that have been focused on the rural, lower income areas instead of the wealthier zones? I get into IRS a lot, and I've read something that the rural counties, rural people are being audited when wealthier people are not. And it has really grown.
This is the first time I've heard that.
Really?
It'll be something that I can look into.
Okay.
But thinking and understanding the politics today, I would say that they're probably thinking that it's an easier target than individuals that have these large firms representing and protecting their dollars. And so if I was just thinking without investigating it, I would say that's been the practice for some time on a personal level for some people. And so I would say that I'll look into it, but this is the first time I've heard of it.
Okay, I think Doug Jones has written a letter to the commissioner concerning this. You know, it is something ongoing.
So he's written to the federal government about this?
He's written a letter to Charles Rickety.
Okay, yeah, that's a federal issue. Yeah, but I'll ask him about
It's
that.
affecting Alabama's rural areas. They're being audited.
Oh, wow.
Higher than the wealthier is what they're saying.
Okay. Yeah, that's something that's at a federal level, but I'll inquire about it.
Yes, please.
Yes, ma'am.
Any more questions for? Any other questions for Mr. Richardson? He's been standing here patiently, so he's good.
This question is for Mr. Richardson. I am Emily Watson. I'm a social worker and of 42 years. And I've been in people's homes, I've been in the hospital, and now I do a private practice in counseling. One of the things that I don't understand is how we have so many healthcare workers who vote against us. That is a big block of voters. And you know your nurses and your doctors and your techs and your housekeeping staff are going to vote like me. But I just, how can we educate? I know you can't as their boss, but how can we as, it doesn't matter what party we're from. I don't care who gets this passed. I would just really like to see Medicaid expanded.
One thing I will say, I think we as healthcare professionals in general need to do a better job at educating the public. I mean, it shocked me to see that well over 90% of the citizens in this room did not even know that we were the lowest reimbursed state in the nation, including Puerto Rico. Decatur, Alabama is one of the lowest reimbursed cities within the state. Now, fortunately, we're a part of Huntsville Hospital system, and there's economies of scale by being a part of a large system. But I think specific to your question, like the Alabama Hospital Association and some of the other associations, becoming a member of those associations so that you can have the conversations with the other administrators so that they understand, number one, and then that is an easier discussion with all of the healthcare providers within their institutions.
I had one more question for him. I went down for the Pink Out Day a couple weeks ago, and they were talking about the state bill 211, which was the abortion ban, which would criminalize doctors for providing abortion services. And one of the things they said was that it would basically make doctors not want to come to Alabama if they think they're going to be sent to jail for 99 years is what they were saying. I don't know if, I mean, that's what we were told by the ACLU lawyers. And I guess I'm just wondering, have you had any feedback on that as far as, right now we have, they saw that as something that would make the rural hospital crisis even worse if it passes. And they said it would be litigation bait for the state legislature, who would end up paying out of the general fund to litigate the lawsuits.
Right. We are not seeing the major impact right now from that particular bill as it relates to hospitals, because many of your abortions are done outside of facilities. We get into more of the complicated abortions where there's issues with the baby or a complication that would be created with the mother, life and death situations, but I have not seen it so far in the hospitals related to that bill and criminal and not being able to get obstetricians or other physicians.
This is a process question about how we can be better organized so that we can mobilize quickly when we know that something is coming up, for a vote, because it is important for every one of us to make those phone calls, for every one of us to write to people. And one thing we did call last week from Indivisible on the grocery tax thing, but the state legislators don't have big staff like the Congress people do, and it's, we need to know the best ways to get in touch with you all, and then if you want to get information to Mr. Richardson, who would then quickly get it out to, to other groups so that we could then, get the ball rolling. But I think what we need to do, everyone wants the same thing, but we have to get organized, and we have to be, we can't just whine and complain. We have to organize, and we have to call, and if we have to come to Montgomery, then we have to come to Montgomery. But it's shameful, that we have one of the poorest states and the sickest population, and we haven't done the one thing that would address that. It means so much. But so if we could get that figured out somehow, if you three could just decide, here's the best way to get this information to the most amount of people.
Cell phones would be good.
Cell phones would be good. Text message, send us a tweet, and then we'll start, spreading it to our networks of people. There's a lot of different organizations represented here. And
A lot of organizers in this room.
yeah.
So if you're really interested in organizing in terms of how you want to do that, you may want to have a few minutes with us before you leave or at the end to get that process rolling. Those of you that are interested in removal of sales tax from food from the state level, that bill is House Bill 322, and it is going to Ways and Means in Education, which is the Education Trust Fund budget, which has not been brought. Yes, we're about to move to the next subject. Before we do that, though, I want us to give a round of applause to Mr. Richardson. Thank you. I think you would want to stay to hear what else we're talking about, though. Our next presenter is going to be Representative Mike Ball. There's been a lot of talk about decriminalizing marijuana, but even more so than that, we have Representative Ball, who has been working for the last 4 years, maybe more, on medical marijuana. This bill was introduced about 20 years ago, and it got very little traction, but Mike has been persistent and has continued to work. So we're going to ask him to come up, talk to you about what that bill does, and then give you an opportunity to ask questions. Representative Ball.
I am probably one of the most unlikely human beings on earth to be an advocate for medical marijuana. When I first started this thing, it started from an email from a desperate grandmother, October of 2013. And it opened with, please consider legalizing medical marijuana. And the fact is, I spent a career in law enforcement, and politically, I know the political climate in Alabama, and I will tell you, so many of our problems we get so over politicized, and when we get over politicized, we get over dramatic. And what happens is we begin to demonize the other side. It happens on all sides of the issue. Since I started that journey in October 2013, I am at a point right now, and where we've been through in the last 4 years, I'm at a point now I hate politics. I absolutely detest it. It is a necessary evil, but we should keep it to a minimum, and we should know how to turn it off. I think we have an excellent chance of actually implementing a very good bill, very good legislation for medical marijuana. But it started with just the oil. I got that email at 1 a.m. and I read it, please legalize medical marijuana, and I read just a little bit. I am a grandmother, and I could read the desperation, I could read the love in it, and she sent a picture of her granddaughter, and that picture caught my eye. And so what I did is I looked at that email, and of course I know Laura introduced medical marijuana bills before, and it just couldn't get any traction. And a lot of times we all have a tendency to make up our minds too quick. But in my previous life, I was an investigator. And an investigator has to be driven by information and by facts. And so I read the email, and I called my assistant in Montgomery the next day, and I asked him to research it. I wanted to formulate an answer. If that lady would contact me at 1 a.m., the least I could do is give her a real reason why what she's asking for is impossible. Well, first she told about the CBD oil and the seizures. So I had my assistant, and I started investigating. Number one, I figured it was probably snake oil, because nothing could be that good. And so I started looking for evidence that would show this wasn't real. And number two, I realized that politically it was impossible. I just needed to show her that she needed to look in a different direction. Well, lo and behold, the more I looked, once you start seeing something, you can't unsee it. And I will tell you, and as I began to realize that there was something to it, that people could be helped with that oil, I went to my knees. And I know this, the Lord suffers with those who suffer. And the Spirit began to move me toward doing this. And it was an election year, October 2014, and it was very, it was just a non-starter in that. But I realized that I had to come out and do this, because once you realize that the Lord's behind it, you don't have a choice anymore. And once you realize that there are people suffering and you can actually help them, then you have to find a way to get there. But the first thing we had to do, and I will tell you, the group of families and people that surrounded myself, there was no politics in this. This was clothed in love. And this was not with a spirit of contention. And we weren't trying to make people do this. What we were doing was, we were appealing to them from a position of love. And then what I had to do, the first thing I had to do to get that bill passed, was I had to change the mindset. I know the Lord had to change the mindset, and I had to be part of it. And we had to get people, when they thought of cannabis, actually the term marijuana was kind of imposed for cannabis to make people, it was as a derogatory. I don't want to get sidetracked. I want to stay on my testimony. But the thing is, I knew that the first thing we had to do was to get people to see those sick people, to see those afflicted, to see those children, to see those people who could be helped. And when they went to the State House, they didn't confront, they weren't ugly, they weren't trying to make people, they were just there, and they were just there in love. And what we needed to change hearts, the fact is, we don't change hearts. I mean, the Spirit of the Lord changes hearts. So we had to create a spiritual environment where people would not be defensive and they would realize what this is. So we could get the image of Cheech and Chong out of their mind and replace it with these sick people who could be helped. And we wound up in 2014, an election year. Even then, it got to the point that folks were afraid, my Republican colleagues primarily were afraid that in an election year they would be beaten up in a primary saying you're pro-drugs. We wound up, and here's what's so amazing, I wouldn't have thought it, but we wound up doing a study. We put $1 million a year in the state budget to study this oil at UAB. The bill I originally started out, I didn't know anything. I'm not a medical person. I'm not a money person. I ain't never had much money. I'm not on one of the money committees. I never will be. Don't want to be. But I come from law enforcement, and I know these people that needed this for this purpose weren't criminals. And our original bill was to give them an affirmative defense so they wouldn't be prosecuted for possession when they're just trying to get well. We wound up passing the research bill, authorizing the research in 2014. And it took 2 years to get that thing set up. Nearly a little over a year, I guess, to get it all set up. Because of all the regulations and the FDA and everything it's like our medical people have been handcuffed to even look at it and consider it. It's just been driven by fear and ignorance. So what we did, we wound up, they finally got, of course I was planning on the research as being a way so that anybody that needed it could go to UAB and they could get it. I was thinking more of treatment. I'm not a research person, but I knew enough to know, and I had seen enough evidence to know that there was something to this and people could be hurt, and the negative side effects were were far less, much less than stuff you could even buy over the counter. So it turned out, by the time it went through the FDA and the DEA and all those other federal entities, it turned out that it just narrowed this down to just a very small number of people when there's thousands that need it. And if y'all have seen, there's been a picture that's been in the paper of me holding Lenny's Law that we came up with. I met their family when we were doing Carly's Law, and Lenny's mother called and told me that Lenny didn't qualify for the program and that they were going to have to move to Oregon. And it broke my heart that somebody like them, helpless, innocent, and listen, the drugs that these people were on, that these children, that these folks were on, just turned them into zombies. And just a few drops of this other, and they needed to be able to cooperate with their doctors. We needed to find a way to do it. But when Amy, Lenny's mother, called me and told me that they had to move to Oregon, it just broke my heart. I called the guy that does legislative relations from UAB and had him take a look at it again, and she just didn't meet the strict criteria. I'm a simple fella. I might not talk right all the time. But anyway, but Amy, of course, my heart was broken and tears just filled my soul. But Amy seemed to take it well, and her and her husband, their whole family, they realized that for that precious child that they would just move to Oregon, and they did. Well, one night, so many of the best things that I've ever done wake me up in the middle of the night. And so I woke up in the middle of the night one night, couldn't sleep, and I opened my iPad and opened Facebook, and Amy had posted, they had just moved to Oregon like a few weeks earlier, and Amy posted a video of Lenny who was like a zombie when I saw her. And she was watching Frozen. And that child had come to life. It was like raising Lazarus from the dead. And I saw joy on that child's face. And while I watched that child watching Frozen, the whole Lenny's Law just came to me, that we had to go back to the first bill that we had that decriminalized, that gave an affirmative defense for people who have the oil. And quite frankly, by then I had seen how the Lord changes hearts, how if I'll just do the next right thing and depoliticize. I will tell you, if you want to get things done, you've got to depoliticize it. You can't look at these legislators you're trying to encourage as evil. They're not. They're just different. They think different. And so what we have to do is come together in a spirit of collaborative thought. And we have to bring down those political barriers. Well, we wound up passing Lenny's Law, and it was never any doubt for me. And Lenny's Law was a bit easier than Carly's Law. And so we got past this election, and quite frankly, the election cycle really don't mean that much to me in doing these kind of things. But it was when we were getting ready to go into this session in right after Christmas, we realized that Carly's Law was about to run out and UAB needed an extension, and there was some little ambiguous language that somebody had slipped in on me at the last minute on Lenny's Law that we had to clear up, we were going to clear up. And so I got Carly's dad and Lenny's mom, and I got the doctor from UAB who had been conducting the research, who probably knows more about anybody in Alabama. And I got a retired appellate judge and a little team of people that I could count on. Listen, I realize how ignorant I am about most things, and I will tell you, once we realize that we don't know everything, then we know to find somebody to ask. And I have been blessed with a lot of people. As a matter of fact, when I first got elected, I sat next to Laura, and she took me under her wing and helped. We've been the best of friends ever since. Because and on the hot button political issues, she's on one side and I'm on the other. But you know what? As soon as we get those things over as quick as we can, and we flip that political switch off, and we think together. Because the fact is, we want the same things. We want to help those we can help. Well, anyway, let me get back on my story. So I get my group together, and Dr. Sparsky and all of the group, he's saying we've got to find a way to get doctors involved. So we start looking at other states to see, because we knew we were going to revisit it, to see what we do. And we saw that Tennessee had this, when all of the smart people that I listened to saw the bill that they had in Tennessee that creates a regulatory agency that properly regulates it. It would regulate the growers, the dispensaries, issue the cards, certify doctors. It's a very comprehensive way of getting medical cannabis in the process with patients and doctors in a collaborative view. One of the things, of course, and there's been lots of things like grow your own and all that. The fact is, Dr. Sparsky tells me that in order to do this, people have to be able to go somewhere where they can get the combination THC and C, the right strain for the doctor. They have to know what they're getting. They can't just buy it off the street. You know, people that want to abuse marijuana, they go buy a bag of dope. They buy it off the street. The people that we're keeping from getting it is people that need it. And so what we have to do is we have to be creative. We have to unlock the creativity in one another's minds. And I will tell you, politics is driven by fear. Every hot button political issue that you ever run into, you will have people who are afraid of something about the other side. And what we've got to do, you know, the Bible says, fear not, over 300 times. Because the Lord knows that fear blocks the creative mind. And it keeps us from cooperating with one another. And a lot of these things that we've talked about tonight, incidentally, and this bill that we've got, what we're doing is we've had it kind of setting. We've been tweaking on it and tweaking on it. And when we start moving it, we're going to start really working to move it. And the Senate sponsor is Senator Tim Melson, who is a doctor, medical doctor, and I've really been counting on him to get it just right. But I do want to say this, as we're talking about, and now you know the reason I'm doing it. It's to help sick people. And as I'm learning, I'm having people who, autism, dementia, there are so many things that this can help. As a matter of fact, UAB just released a study on our opioid epidemic, and one of their recommendations was to legalize medical cannabis. It is because people could have this for pain instead of that. And there's a clear correlation. States that have medical cannabis have a decrease in use of opioids, and Alabama is number one in opioid abuse. And this is something that we can fix. However, the important thing is you got to depoliticize it. Because when you start trying to force something on somebody, that causes them to push back. What you have to do, you have to approach in love and in compassion. And if we're clothed in the spirit of compassion, there's no limit to what we can get done. I will tell you, when y'all, can I give these folks some lobbying advice just a moment? Oh, I'm sorry, I didn't mean to. One of the things I would tell you, when you, is there media here? Okay, good. Okay, people. when you approach conservative Republicans, do not say expand Medicaid, because that's a hot button political issue that stirs up everybody against it. And I will tell you, this medical cannabis bill, it's got a fiscal note, it's going to raise some money, it's going to go to the general fund. And I hope it will help keep our rural hospitals open. And I hope that together we can find a way to make health care available to our poorer citizens in many different ways, whatever way we can, that we can have that we can find a way to draw down that federal match. And so what I'm saying is, if you take the right approach, you can move hearts. But you know, I just get so sick of politics and the people fussing and squabbling at one another all the time. Maybe I've been in too long. Anyway. Please find a way. Please find a way to fund our health care, to help poor people get health care. Keep our rural hospitals open. Keep our hospitals open. There's lots of other things you can say that don't automatically get put in a defensive posture. Because when somebody gets in a defensive posture, I used to do interrogation. When somebody gets in a defensive posture, you're not going to cut through. They're not going to hear you.
Call it the jobs program that it is.
So and that's part of the meetings that I've been talking about. A lot of times, the outside forces, the base, that are more farther to the right, will oppose this because of it is essentially an extension of Obamacare. So let's talk real here. And so my thing is, and our thing is, whatever it's called, it can be called K-Care. I don't care. And so we're getting to the point where the name is more over politicized than the actual of what we're trying to accomplish. And so it may be called the Rural Health Care Act, Sustainability Act. We're working on that. So what we're trying to do is get it done without having it to become a political hot potato, and we don't get anywhere. So you sent us down to Montgomery to try to deliver on this. And so it may not be in the red and white box that you want, but it may be in the blue one. And so what I'm saying is, the reality is, there are millions and millions of dollars that have been spent to demonize the word expansion. But if the details are the same, then who cares what the name about the name? And so that's what he's trying to explain, because it's very difficult to herd folks in one direction, poor people in one direction, that have been watching hours and hours and hours of television where something has been demonized. And so what we're trying to do here is get it done without the political forces chopping at each other. And so that's what he's talking about, is when you approach them, members in the legislature that may not totally be on board, just have a conversation about health care as opposed to the name. And so you can call it what you want. And so that's kind of how you get from point A to point B.
One political department, like save our rural hospitals or whatever, so that we're all on that page, pushing for the same.
And I would say that's being worked on too. And it's not being worked on from us as legislators, but the group like the Hospital Association and others, they're working on the name. And because we don't have the resources to run TV ads and all those things, they will be doing this.
I did talk to somebody from the Hospital Association. I don't remember the name and what they were calling, and but it was. I remember that I liked it, and then I got off on something else. I will say this: ADHD is such a horrible thing, but hyperfocus is a superpower. But I want to say this about what I've seen about Governor Ivey. I've been around a long time, and I was in the middle of the previous guy, and it was horrible. Well, not of that, but I was in the middle of, you know what I was in the middle of. I was in the middle of trying to get it to come to light, but I don't. Being an investigator, when you see stuff, you can't unsee it. But I want to say this about Governor Ivey, is that Governor Ivey seems to genuinely be trying to depoliticize as much as possible and find ways to navigate through and to get Medicaid to work like it should. So we're in a very unique time in Alabama history where I think people across the political aisle, I mean, there's still a few bomb throwers, but I will tell you, I think there's people in key places that want to solve problems, that are tired of seeing things, and it might not be the political red meat. As a matter of fact, if we're doing it right, there will be people on the left and people on the right, on the far extremes, that will hate us. As a matter of fact, I've learned that those people on the far edges hate you, you're probably doing the right thing. Oh, any questions? Yes.
I just wanted to thank you. Thank you so much for getting up here and speaking about medical marijuana and the benefits of the oil, you know, whether it be CBD or THC. And then I also kind of wanted to comment that I'm very young, and from a young age, I was raised to be very conservative and, you know, right-winged and Republican, and that's what I voted for right out of high school. Moved away to California, came back. My father, he got sick, and so we had to take care of him for 6 months. You know, we had to be his hospice at home. But long story short is that I'm with Alabama Normal, and we've been working with all different types of parties, Libertarian, Democratic, Republican. And they all want to listen, they all want to learn, and it's very true. You can't just say, you know, you have to ask people about them and get to know them so they'll open up to you. So certain words, yes, are going to make people, you know, turn off their minds and not listen to you so much. But now more about medical marijuana coming into play in the state of Alabama. I believe it's great. Almost, I think, would you say regulatory center, almost like an ABC board for Alabama, but make it a medical marijuana board. I don't know how that would go. If I could, I would go out to each state and just ask them, hey, how are you doing this medically?
Actually,
law enforcement.
Actually, the way I came up with that bill, the Tennessee Medical Cannabis Trade Association. Once we saw that the Tennessee bill was the one we liked, I went up to Nashville. I met with the sponsor, Senator Janice Bowling, and I got in touch with the Tennessee Medical Cannabis Trade Association is headed up by a guy that was a Republican from state of Washington that term limited out. And he moved back to Tennessee where the roots of his folks, the roots of his family, I think he had an elderly parent. But anyway, he moved to Tennessee, and he has been for several years, him and his partner is a Democrat former Democrat from Colorado who term limited out, and who was also a strong proponent of medical cannabis. And both of these guys and many others, they have been studying for years, for several years, all these different states and how to make it work. And Dan Pavon, he was in Colorado when they were setting theirs up, and he sees some of the mistakes they made and how they should have done and could have done, and the same with the other guys. So what I have done is I have relied, instead of setting up a study group here in Alabama, what I did is I took the folks that already studied it and who know more about it and who know how to develop a process to make it work, and I took their idea, and the main thing I do is I've just taken their idea and put it in front of other people, and it's amazing in that legislature, people are picking up. If we get through the little hurdles, we got the votes. There's lots of votes out there. I'm just wondering how big a majority it would be if I can get it to the floor.
What is do you have a number or name for that bill yet?
You remember I told you I'm ADHD, numbers don't stick in my head real good. If the bill that I introduced is one of them, Senator Melson has a companion bill in the Senate. Melson, M-E-L-S-O-N. He's from Quad Cities. He's a retired MD, and of course he's supposed to be talking to all the medical people and having eyes on it and making sure this thing is as good as it can be, because the fact is it's not about. A lot of times things get bogged down in money, but it's about helping sick people. That's why we have hospitals. That's why we have, and it's about using everything available, and this is available. Any other questions? You know, I hardly ever go to my Facebook page. Actually, I was writing a book, but I kind of pulled the plug on it for a while. But I will tell you this. Go to Lenny's Law. Has a Facebook page, and Amy, who is... Yes, that's it, HB 243. Thank you very much. Oh, good. But actually, if you will contact Amy Young at Lenny's Law is a Facebook page, and we can get you their contact information, and she'd be glad to share all the information about it. But I just focus on taking the next right step.
Has there been any thought or conversation around possibly combining the medical marijuana law with some sort of incentives to have it grown like in the Black Belt? You know? Actually, what we're doing, we're creating a regulatory board that will be very doctor heavy. There'll be a lot of medical people on. I think we'll have an agriculture person on, maybe one appointment from the Attorney General's office. But most of it will be doctors. It can be maybe 9 to 12. I don't know where we're at right now. But one of the things they're going to do, they're going to license and regulate and allow people to apply to grow it. It's going to be Alabama grown. It's going to be inspected by the Department of Agriculture. It's going to be Alabama grown, and then dispensaries. The state isn't going to get in the business of doing it. What they're going to be a regulatory agency, and there will be dispensaries that will be licensed to purchase from these Alabama growers. And where they grow it, I don't care. But I will tell you, and that's an agriculture area. I'd be shocked if a great amount's not going there. And I would say this: if it looks like there's not an adequate amount going to the Black Belt, we could see that will happen. But I'm pretty sure that's going to happen. No. We don't want to get in trouble. Don't go there, Jerry.
So Alabama A&M and Tuskegee have already received support of growing and studying hemp. And so there is diversity and inclusion inside of all of the things that we push through legislation now. And so you can be rest assured that Representative Hall will make certain of that.
Actually, the structure that the Department of, it's amazing how these things work independently but work together. I mean, that's how you can tell that there's something else going on, something we don't understand, something beyond all of us. Is that the infrastructure that the Department of Agriculture is having to grow and regulate and inspect and test the hemp producers will also work to help regulate the medical marijuana producers. And so when we're doing the right thing and when we're in the right mindset, it's amazing how good policy leads to other good policy. And this next 4 years, I think, will be an exciting... We're in a good spot right now if politics don't destroy it. And what we all have to do is keep our hearts humble and in looking at the right thing, which is helping one another and finding ways to encourage one another to do the right thing.
Who's going to oppose it?
We,
Yeah, is it going to be the pharmaceutical industry or?
right now, I would say if the bill get to the floor, the train is running at 100 miles per hour. I don't see anybody stopping coming up.
And one of the things is, you see, what the approach that those Carly's Law and Minnie's Law families took, it was surrounded in love. It was love and faith, and it was a spiritual approach that they took rather than a political approach. And so the legislators, the leadership, they were there, and they saw, it's hard to believe, but when those bills were on the floor of the Senate, and when they were on the floor of the House, you can ask anybody that was there, the legislature became a holy place. You could feel the Spirit of the Lord. And I will tell you, I know it sounds, it's unbelievable, but Moses, you know, the Lord parted the Red Sea. What I'm saying is, the Lord does change hearts, and I will tell you, He throws my faith. And so, if we're in the right spirit, there's no limit to what we can do. If we're in the wrong spirit, we ain't gonna do nothing but just fuss and work.
Let's thank Representative Mike Ball. Certainly want to thank the volunteers. Mr. Viola, thank you for volunteering your time. And all of you, I know that you could be doing anything else on a Monday night, but you chose to be here and continue to support the efforts that Representative Hall is leading. We will continue, as promised before, we will continue to have these sessions to talk about the various issues that may be of concern or issues that have been brought to our attention by our constituents. It seems like from the conversations that have taken place today, the next issue is going to be dealing with nursing homes and senior services, and so that's something that we're going to be pushing, and we'll need your help. And so we'll look at doing that in May, and we'll probably have a different location. So we've been moving around the city and the county, and just trying to make certain that we give equal opportunity to everyone. And so thank you. Yeah.
On Monday, Representative Hall is leading a conversation on aging in Alabama at the Legacy Center. And so I just want to invite anyone out that wants to come. It's at 10 o'clock on Monday. We're going to spend an hour hearing and talking about some of the issues.
Okay, absolutely. So, again, thank everyone. I'd like to thank everyone for coming. We certainly appreciate you. And we'll see you next Monday. If you've not signed the sign-in sheet, please sign in sheet in the front so that we can stay in contact with you. And let's give Dr. Walker a round of applause for allowing us to be here. Thank you, and let's go see you next time.